Hi, this is Michelle Walker. Today we're going to be doing a checkoff for how to insert an indwelling catheter. And first I wanted to recite the CAWIPE, which is check your patient orders and your patient allergies. You want to assess the patient and assemble any necessary equipment. You want to wash your hands and don your gloves and any necessary PPE for the procedure. You want to identify yourself to the patient as well as identify the patient with 2 identifiers. And then you want to provide for privacy. And then lastly, you want to evaluate patient, educate your patient, and explain to your patient. So this is female, Mrs. Bear, and I've got her in she's going to go into a dorsal recumbent position. I have a frog leg position here for the indwelling catheter. So I'm going to have all my necessary equipment here. I've got my, I'm going to assemble my sterile field. I've got an extra pair of sterile gloves off to the side just in case the first pair doesn't go on appropriately. I've got my non-sterile gloves to do the whole setup and preparation first. I've got a blanket to provide extra coverage for the patient, and then my fenestrated drape, if I decide to use it, is also in the sterile field. We've got a specimen cup in there to collect a specimen if that's what the order warrants. And then the bag, of course, is in there as well that we're going to, at the end, hook onto the bed frame, not the bed itself or the rail, just onto the bed frame and below the body. So we've got her covered up. We're going to go ahead and don my gloves here. I'm going to first provide perennial care, wash her up there. You're gonna make sure she's not allergic to the iodine. And I'm also going to pull over a trash can. Okay. So, setting up my sterile field here. Okay. Making sure not to cross over that margin on the sides there. Okay, and so I'm going to take off my gloves here. I'm going to take out my sterile gloves. Which are not in there. I must have used those. I got a pair there, so thankfully I did that. And then go ahead and put the sterile gloves on because now we're working in our sterile field. more sterile. I'm gonna keep my hands below my shoulders, but above my waist. I'm never gonna cross over to cross-contaminate, and I'm never gonna turn my back on the sterile field. All right, so I'm gonna kind of shift things around here. All right, glossy side of the sterile field is gonna go down. Protecting your hands. And you can ask the patient to lift up her buttocks to help. Set that underneath there. I'm just gonna prepare everything here. Iodine swab, got my saline, got my lubricant. We're going to discontinue. I've got an extra syringe in here. Here's a fenestrated drape. I'm not going to use that, but if you were to use that for an extra sterile field, you would just place that right over the male or female part. Also still protecting your sterile gloves there. Here's our specimen cup that if we were to collect a specimen, we would make sure that we put the patient identifiers on here as well as the date and time after collection. All right. So I'm going to go ahead and hook on the saline solution for when we blow up, making sure that your catheter stays in the sterile field here, for when we blow up the balloon. Okay, so we've got that hooked up there. I'm gonna go ahead and take out, pretend, I'm not gonna actually do it, but I'm gonna, well, I can do it here. Take the lubrication jelly and squeeze it into your sterile tray, and then put about 1 to 2 inches of the tip of your catheter lubricated well at the end there, and just lay it there for when you're ready for insertion. That's off to the side. Okay, so you've got your iodine swabs here. So you're going to use your non-dominant hand here, and you're going to spread the labia, and you're going to take each swab, 1 stroke per each swab, and you're going to start on the farthest side and swiping down from the clitoris down to the anus on 1, and then dump it in your trash can. You're going to take a next swab, and you're going to swab the innermost labia, and then you're going to toss it. The last swab, you're going to go down from the clitoris down to the anus in the middle, stroke it down, and throw it away. All right, this hand is no longer sterile, so we're going to keep it there anchored. We're going to then ask the patient to bear down. So you've got the meatus all clean. So ask the patient to bear down. And for females, they have a shorter urethra, so you're going to go in about 2 to 3 inches. Males, you would go 7 to 9 inches for longer urethra. So I'm going to go 2 to 3 inches in on her. Once I start seeing urine, I'm going to go in about 2 more inches, and then I'm going to proceed to blowing up the balloon. So she's going to bear down, and I'm going to slowly insert. And you're inserting, and then I see some return. So I'm going to then anchor with this hand, and I'm going to take my sterile hand, and I'm going to blow up the balloon with all of the 10 cc's of saline, and so that the catheter stays anchored. Okay, and then I'm going to go ahead and tug it out just a little bit to make sure it's placed. Okay, and here we go. All right, then you can go ahead and let go because it's anchored. Just pretend that stayed there. And then you would go ahead and proceed. This hand's contaminated, so I'm just going to grab my sterile bag here. I'm going to attach it to the inner thigh. So I'm going to pretend I have some tape or a lock, inner leg lock there. I'm going to attach it to the tubing on the side, and then I'm going to attach the bag to the bed frame there, just below the body for good drainage, okay? All right, so that is hooked onto there. Now, if you wanted to take out the catheter, you would go ahead and look at the chart, see how many cc's of saline was put in, so you know how much to take out, and then you would just quickly ask the patient to bear down and pull out the catheter and wrap it in your hand and dispose of your sterile field and all the drainage bag. You would drain the bag first before you ever start taking out the catheter. So that's that for an indwelling catheter. You want to document your findings. You want to document how the patient tolerated the procedure, how much fluid you put in, blowing up the balloon. All that needs to be documented at the end of the procedure. And that is it. Thank you so much.